Good morning, everyone. Bonjour tout le monde. Before we begin, I'd like to acknowledge that we are gathered here on the traditional unceded territory of the Coast Salish First Peoples, the Musqueam, the Squamish, and the Tsleil-Waututh. And as we go through today, that acknowledgement will be ever more important for us in the reflection of the work that we are doing together and hopefully will continue to do together over the coming weeks and months. My name is Taleeb Noormohamed, and I am the Member of Parliament for Vancouver Granville, and I am so pleased and grateful that we are all here today. Now, to make sure that we start ourselves off in a good way, I'd like to introduce to all of you today Mr. Shane Point Silkson. Silkson is a proud knowledge keeper who belongs to the land of Musqueam. He's an artist, he's a teacher, a cultural mentor, and an active community member. Silkson has been of service to his family, community, and others officially since 1976. And over the past 4 decades, he has participated in cross-cultural work for the federal, provincial, and municipal governments, and is now working with the province of BC's health leadership. Please join me in welcoming Shane Point Silkson.
Not somewhat squall Maminos. Oh, oh, oh. My friends, I'm asking the infinite to please lift up our hearts and our minds, lift them up, provide us with the strength that we need to continue to move forward as one. The wonderful Coast Salish word is Nutsamant. Nutsamant, translated, simply means we are one heart and one mind. In the chant, I'm also saying thank you to the wonderful gentleman who's going to come forward and say his wonderful words. I'm saying to the infinite, thank you. Thank you for this gentleman. Thank you for bringing him here from such a great distance to lift us up. In the language, Shayeth Siem, Shwanam. He is our older brother who's a minister. I'm saying to the infinite, thank you for allowing him to come here and to lift us up. Siem, Skak, British Columbia. He's coming here to lift the people of British Columbia, lifting us up with his great strength, his kindness, and his generosity. So I'm saying thank you to the infinite for him today and those vast numbers that support him. Haitsapka Siem, Haichka, Haichka, Haichka.
Thank you so much, Silkskin, for those incredible words. Like you, I'm really excited to be here today at this important announcement, which is going to connect Vancouverites with the sexual and reproductive health services and resources that are culturally safe and stigma-free. Before getting into politics, I spent many years working with at-risk youth. And one of the major issues that kept coming up was access to culturally appropriate sexual and reproductive health services and the challenges that youth particularly faced in accessing those services, and the challenges and needs that they had often went unnoticed. And I think today is going to be an important day in helping to ensure that that is very much behind us. So I'd like to extend a big thanks to BC's Provincial Health Services Authority, PHSA, for hosting us today. PHSA has been working to improve the quality of healthcare for Indigenous people, to foster cultural safety, and contribute to closing the gap between Indigenous and non-Indigenous peoples in BC. We're grateful for all the work that you do. And now it's my privilege and honor to introduce to you today the Honorable Mark Holland, Minister of Health. Minister Holland was elected first as the Member of Parliament for Ajax in 2004, and he served until 2011. He was re-elected in 2015 and has been serving ever since. In both his public and private roles, Minister Holland has backed healthcare initiatives. He was the Executive Director of the Heart and Stroke Foundation of Canada's Ontario Mission, as well as its National Director of Children and Youth, and helped to secure funding for Grandview Children's Center's future Ajax location. But he's also an incredibly empathetic, intelligent, kind, and action-oriented individual. And, you know, when we're introducing ministers of health, it's often important to remember two things. One is that you require a tremendous capacity to understand and appreciate data and to deliver outcomes, but also to have incredible empathy and kindness for the people who are at the front lines and also the people that the Minister of Health serves. And so it's my deep pleasure and honor to introduce my friend, the new Minister of Health, Mark Holland.
Thank you, Taleeb. Thank you for your leadership and for your friendship. It's fantastic to be here today. C'est un grand plaisir d'être ici pour un moment tellement important pour le pays. It's my first announcement today as Health Minister, and I just want to take a moment first to thank Salkson. We had an opportunity to talk and to be able to take in some of his wisdom and see his incredible art. I really appreciate his presence today. I want to thank the PHSA for all of their incredible work, Heather, to you and your entire team for all of the work you're doing to improve lives and to work in this extremely important space. You know, I've had a number of opportunities over the last number of days to talk to healthcare workers about some of the challenges that are facing us. And, you know, this being my first announcement as health minister, it's particularly important because when we think of sexual and reproductive health, we understand how important it is to prevention and overall health, but there's a broader story there. We know that access to sexual and reproductive health services is marred by a myriad issues, whether or not it's shame, people being afraid to come forward, and that those problems are extremely exacerbated when we're talking about Indigenous, Black, and racialized communities, members of the 2S, LGBTQI plus communities, new immigrants, that there are many different barriers that are faced. And in talking to Sam today, who's one of the folks who out there on the front lines working with youth, you know, what she said to me that really resonated, that's so powerful about what's happening, this is community-led, but even more so youth-led. You know, nothing is more important than our sense of identity, the ability to be ourselves and to be proudly ourselves and let that inner self radiate out. But whether or not it was the practices of colonialism or its bigotry or its hate, oftentimes our ability to be ourselves is marred by the actions of others. And when Sam goes and helps lift up youth and lets them see themselves and inhabit themselves with pride, to understand who they are and their connection to their heritage, that is an explosive power. There is no doubt that when we're talking about the crisis that we have in mental health, that there's a direct correlation to those suffering the most with those who have been discriminated against and those who have faced the most egregious forms of racism and bigotry. And so that connection, not only to sexual and reproductive health services, but the actualization of people being proud of who they are so that they feel empowered to get those services, to get that help. Because it's not enough that the services are available. People have to walk in the door and be able to have access to those services. It's not enough that those services are there, but we have to make sure that rural and remote communities have access to those services. And it's why today I'm extremely proud to announce that the federal government is making a major investment in supporting sexual and reproductive health through the Sexual and Reproductive Health Fund with more than $4.3 million. $1.8 million will go to British Columbia's Provincial Health Services Authority for the Indigenous Health to expand educational materials for Indigenous-led Sanyas program and Indigenous youth wellness programs. $1.4 million to the National Council of Indigenous Midwives to improve sexual and reproductive health services to reduce barriers for Indigenous, Black, and racialized communities, as well as immigrant women. $600,000 to the Native Women's Association of Canada to identify information gaps that pose barriers to accessing sexual and reproductive health resources, and $500,000 to Les Femmes Mishif, Atipem Weskwak to identify barriers for Métis women and 2S LGBTQI+ communities. Through these projects, we're helping close the existing gaps and help Indigenous and marginalized communities have access to culturally safe and stigma-free reproductive health care. Aujourd'hui, nous annonçons un financement de plus de 4,3 millions de dollars via le Fonds pour la santé sexuelle et reproductive pour 4 projets tellement importants. 4 projets qui sont tellement proches de mon cours. Le financement annoncé aujourd'hui va aider à mieux comprendre les barrières existantes et aider les communautés autochtones et marginalisées à avoir accès de soins de santé sexuelle et reproductive sans stigma et culturellement sécuritaire. C'est un grand plaisir d'être ici aujourd'hui avec Taleeb et avec toute l'équipe qui sont responsables pour le travail tellement remarquable. I look forward to the journey together. I look forward to seeing the results that these dollars will bring in changing the lives of so many people. Thank you. With that, I think it's on me, actually. My apologies. Heather Hastings. It's my pleasure to introduce Heather, who's the Executive Director for Indigenous Health for PHSA. Heather, again, through you to your remarkable team, thank you for all your work, all the work you're doing. It's a real honor to me to be here with you today, and it's my pleasure to introduce you and to welcome you to the podium.
Hi, and good morning, everybody. My name is Heather Hastings, and I'm Coast Salish from Sartlet First Nation with the CNH Territory on Vancouver Island. I'm the Executive Director of Cultural Safety and Transformation within the Provincial Health Services Authority and have the opportunity to work alongside the Sanyas team and the Youth Wellness team and the great work that they're doing that will be supported by this grant. I want to thank Salkson for his opening prayer today. I always appreciate you being here, and you always remind me, as you did today, that we should be having fun, which we also heard from the Youth Wellness team today. I want to acknowledge that today I am a guest of the traditional, unceded, ancestral, and present homelands of the Musqueam, Squamish, and Tsleil-Waututh people, and I'm glad to be here today with you. And thank you, Minister Holland, for traveling here and meeting with us today, listening to the youth and their experiences. And I think what you heard today was their heart and their passion that goes beyond their work, and it's just a part of who they are as people. And I want to thank you for sharing your announcement with us. The Health Canada's Sexual and Reproductive Health Fund is supporting the work, as mentioned, of the Sanyas and the Indigenous Youth Wealth programs to enhance training and wellness programs, to increase knowledge and skills of healthcare providers and support Indigenous women, girls, youth, and 2S LGBTQIA+ people. We now know and understand how colonization and racism has created barriers to health for Indigenous people and have led to poor health outcomes. Through this grant and through this work, we aim to understand how Indigenous identity intersects with gender and sexuality, and how the experiences of Indigenous women, 2S LGBTQIA+ people, as they are further impacted by racism and discrimination. By working on the curriculum, teaching and learning tools through Indigenous and community-led programs, upholds the voices of Indigenous people. We have learned over the years of some of the harms experienced by Indigenous women, girls, youth, and L2S LGBTQIA plus people when accessing health services, and are working to expand this curriculum to help uphold the voices of Indigenous people and to help the healthcare professionals do better and support Indigenous people within their healthcare experiences. Within BC, we have the DRIPA and DRIPA legislation and action plan, which also mentions Indigenous women, girls, and 2S LGBTQIA plus people must enjoy full protection and guarantees against all forms of violence and discrimination. We recognize that we have an obligation to this work. So I thank and raise my hands to the youth wellness team and the SANIAS team for the work that they're doing to start this journey and towards this and upholding this obligation. Again, thank you for your announcement here today and meeting and hearing from the team. I look forward to future conversations as we progress in this work. And just really wanting again to acknowledge the work of the Youth Wellness and SANIAS team. And thank you for being here today.
Well, thank you, Heather, for those for the work that you do, for the work that your team does, and of course, Minister Holland for being here. I think it's important to note that your first announcement is here in British Columbia, and thank you for taking the time to be here with us in BC and to learn so much about the world-class healthcare that we have in British Columbia and the work that we're doing in partnership with the province to continue to deliver for our citizens here. With that concludes the speaking portion of our event. I'm now going to hand it over to Guillaume, who is right over there, to take over, and he'll be taking any questions and we'll take us from here. Guillaume.
Cool. Thank you. So we'll start with a question on the floor. There's a lot of people online as well, so please stick to one question and one follow-up if possible. And please come and ask your question at the mic so people online can hear you. Is there any question here on the floor from reporters or reporters only? Reporter.
Hi, Minister Holland, will your government implement the universal public pharmacare program? Will you follow the recommendations of the Hoskins report commissioned by your party to implement the universal public single payer pharmacare program?
Well, first of all, I want to say with respect to pharmacare that we are committed to ensuring that Canadians have access to low-cost drugs. And that the drugs that they need are available. And I look at the pilot project that we're running right now in PEI that's had absolutely extraordinary results in adding additional drugs to the formulary and reducing costs and really improving health outcomes for folks in PEI. And I know I had a great conversation yesterday with my NDP critic, Don Davies, and with my former counterpart, Peter Julian, who was the House leader, around how we can work together on furthering those goals. And I think that it's making sure that that Canadians have access to the drugs that they need, making sure that those drugs are affordable, and that we put Canadians' health at the center of all we do is critical. And those conversations are continuing, and appreciate the question.
Okay, thank you. We'll move to the Zoom portion. Charlene, to you.
Merci, Guillaume. Nous allons maintenant prendre des questions des journalistes sur le Zoom. Si vous avez des questions, n'hésitez pas de lever votre main. We will now proceed to questions from journalists online with the Zoom. If you're a reporter and wish to ask a question, please use the hand raising function. Our first question is from CBC News, Marina von Steckelberg. Go ahead, Marina.
Good morning. I realize, Minister Holland, that you are the health minister, but you are a minister available to us today. So I'm hoping you can answer this question in English and French. Global Affairs Canada says that Conservative MP Michael Chong was targeted in May by foreign interference believed to be from China. The Liberal government has still not even found a new rapporteur to replace David Johnson to look into foreign election interference. Why is your government moving so slowly to deal with this issue?
Well, thank you for the question, and I can say that the issue of foreign interference is one that our government has taken very seriously from day one. I can tell you that when I was the critic for public safety and national security, one of the things that we said had to happen was to have independent oversight of our security and intelligence agencies, particularly in the form of parliamentarians of every stripe, being able to look into every aspect of what is happening within our intelligence service. And that's where we created NSICOP. That means that every party, the Conservatives, the Democrats, the Liberals, the Bloc, have the ability to take a look at all information and to be able to see exactly what the scope of the problem is. We do know, and it's important to say, as we're dealing with foreign actors whose objective, and let's be clear, their objective is the destruction of our democracy. They are not pushing for any particular political party. They want to see democracy fail. And what we do know is that in that process, they were unsuccessful in the last two elections. There were independent studies that verified that those elections were free and fair. And that we know that these pressures are going to continue by China, Russia, and other aggressive actors. We're having the Minister LeBlanc, who's the Minister of Public Safety, is having very constructive conversations with the other parties. I've been having, in my role previously as House Leader, opportunities to talk with the other parties to make sure that we get approach that puts partisanship aside. This is our democracy we're talking about. It's absolutely essential that we're all on the same page and making sure that we repel these threats against our democracy, first and foremost. And secondly, identify where and how these challenges might have been present. But we do need to be patient and careful because much of this information is by necessity dealing with national security and intelligence. We have to protect those that are in doing the work of protecting us and keeping us safe. And so those conversations have to be careful and deliberate. And I'm pleased to say that good progress is being made.
Can I get that in French? And I'm hoping that won't count as my follow-up.
C'est l'ingérence étrangère, c'est un enjeu tellement sérieux. Il n'y a aucune question sur ça. Au début, notre gouvernement a créé les comités parlementaires indépendants de vérifier que c'est possible de voir n'importe quel type d'information. Et quand j'étais critique, j'ai expliqué clairement que c'était quelque chose de tellement important. Maintenant, je pars avec mon homologue dans l'autre partie, avec les autres leaders dans des autres partis. Et c'est clair que les conversations avec le ministre Leblanc sont productives. Et je suis certain, avec prudence, qu'on va s'assurer que notre sécurité nationale est protégée et aussi en même temps que l'information secrète est protégée aussi.
In English and French, I'm hoping as well. You know, this happened in May. How worrisome is it to you, even with all of the attention we've had on foreign interference over the last several months, that this type of interference is still happening? And why are you not moving faster to tackle it?
Well, we go back to the conversations that we were having at the time that Justice O'Connor and Justice Iacobucci issued their reports. And I was speaking then about the urgency of action, about the urgency of independent oversight. Unfortunately, the previous government did not act on that. We did from day one. But let's be clear that whether or not it's China or it's Russia, they will not stop in their efforts to undermine democracy. Their objective is for the continuance of totalitarian states. And so the disruption of our democracy is their goal. The protection of our democracy, which is something that has been charged with us since the moment our democracy was founded, is something that is going to be a constant battle. It is going to be something that we never cease from having to protect. The flame of democracy is more fragile. And there are forces that would seek to destroy it. But it's imperative that as we have that oversight and as we ensure that our elections is free and fair, as evidence the last two elections were, that we also make sure that we're deliberative and careful and in our conversations with one another. The conversations that I've had with the other House leaders when I was a House leader were incredibly productive about saying we have to reduce partisanship. We have to work together, that national security is too important to play games with. And that work, I can tell you from being House leader, of finding common ground with political adversaries on something as complex as foreign interference is not easy. And it takes time to have those conversations and to get on the same page. But I think it's worth it. I think it's worth it to get to a place where hopefully Parliament can be of the same mind in how we repel this threat.
In French?
C'est pour moi, c'est évident qu'on doit travailler ensemble. On doit réduire les partisaneries. Et ça demande la patience. C'est tellement difficile de travailler avec des autres partis. Et tout le temps, il y a des partisaneries dans la politique, mais sur les questions de la sécurité publique et nationale, à mon avis, c'est important de réduire les partisaneries et de trouver de l'unanimité, si c'est possible. Et avec le ministre Leblanc, c'est clair pour moi, et avec mon conversation avec des autres partis, c'est clair que c'est possible. Et ça demande la patience, mais le progrès est là.
Merci. Next, we have Emma Boyne from the West Shore. Go ahead, Emma.
Can't hear you there, Emma.
Oh, sorry. I just realized I was on mute.
We've all been there, no problem.
Rural communities are quite affected by sexual healthcare and how they've been, there's a lack of that sexual healthcare. So can you give any remark on how rural areas, such as those in the West Shore, might see these programs integrated?
Sure. Yeah, I think this is such an important point, and I was trying to touch upon it in my introductory comments, that it's not enough that services exist. They have to be accessible to folks in rural and remote communities. So, having initiatives that are community-led and talking to the team that's responsible for to reaching out and working with youth to go to where they are, to lift them up where they are, because there's two aspects of that. One is making sure that within rural and remote communities, that services are available and that there's a way to connect folks to those services. But then, as I say, there's also the stigma that sometimes exists around being able to raise your hand and say that you have a need that needs to get attended to. When we're looking at our health, we still have a long way to go on mental health, on sexual and reproductive health. There's many areas where, it should be looked at the same way as, if I were to go and break my leg, I would walk into a hospital and I'd say, hey, I broke my leg, I fell down. Our sexual and reproductive health should be exactly the same. And so it's not just a question of getting into these rural and remote communities. It's about attacking the stigma that's imposed upon people so that they don't feel safe or able to come forward and tell their story. And imagine for a second the impact of that. If you're sick and stigma is stopping you even from seeking help, what is that going to be saying about what has been done to you in terms of your mental health overall? So these issues are multifaceted. And one of the things that I'm really impressed by with the approach that's being taken by PHSA, taken by the community partners that I'm talking about, is their understanding of they need to take a 360 approach to this, that it isn't just as simple as making sure that the service is available. You have to attack the reasons why people aren't getting those services that they need.
And then with my follow-up question, recently an Eskimo MLA stepped down due to a case where 2 Indigenous children were misproperly handled with their foster case. There was a lot of issues going on in there. I don't know if there is a relation to sexual health, but more so healthcare. How can we improve situations like this and ensure children are safe and ensure there will be safety going on in those situations?
Well, it's a great question, and I can answer it more broadly by going back to that community-led approach, youth-led approach. When we're, as a federal government, we have a vast country with an enormous population spread across an incredible distance. It's impossible for us to know what's happening in individual communities. We rely on partners on the ground really to understand the dynamics of what are happening there. And we need to make sure that we empower those community leaders and community organizations to deliver the help and support that's needed for them to understand what are the unique challenges that are being faced by that nation or by that community, and make sure that we're there to lift them up and to support them rather than to impose solutions. And I think the more that we support services at a community level, the more we listen at a community level, the more that we empower at a community level, the better the results we will have.
Thank you. So now we have the last call for questions on the Zoom. Dernier appel pour des questions sur le Zoom. There's no more questions on the Zoom. Back to you, Guillaume.
Cool, thanks. I'll pass it over to Neil from pot.tv for a question.
Yes, thank you. And thank you for being here. For the last, we're into our 8th year now of this public health emergency, which is the overdose crisis. The cannabis substitution program has for 6.5 years been providing low cost and no cost cannabis, especially in the form of high dose edibles, and has been very successful in getting hundreds of people off of those hard drugs, rescuing them from addiction. Our issues with Health Canada, it's been almost 3 years. We've been struggling to get them to license us or exempt us in some way. The previous minister, we had his ear. Will we have your ear on this as well? Will you help us in this matter?
Thank you so much for the question. So first of all, I would be more than happy to take a look at the research and data. I can tell you that I am somebody, coming from my background with heart and stroke and research. I'm all about evaluation and data. And if we are going to get out of the crisis that we're in, I know Yara Sachs, who's the minister responsible for mental health and addictions, and I have talked many times about this, that there really needs to be a couple of different things that are done. One, look at the research, look at the data, see what is working and follow the data. Two, understand downstream how we stop these addictions from taking place in the first place. That there are so many things that contribute early in the journey of somebody getting addicted to something that's destroying their life and making that choice that we have to tackle directly. And it's no surprise that it's the most vulnerable, the most marginalized, those that are pushed out and not feeling included and not feeling a part of our Canadian story, that are the ones that most likely to fall prey to this. So we have to tackle it with evidence, with science, and we have to tackle it with empathy, and we've got to go downstream. And my ears are always open to any solution that will help ameliorate the circumstance.
Thank you very much. We have proven quite well that if there was easy availability of especially the high dose edibles, it's not the smoked cannabis that works to get people through withdrawal, but the high dose edibles does that. There's plenty of studies on that. I look forward to working with you on this and hopefully being able to get this done so we don't turn our backs on these very vulnerable people. Thank you for your time.
That closed the Q&A portion of the press conference. Thanks again to PHSA for the work you're doing and for hosting us today. And yeah, that closed the press conference. Thank you.